Welcome, friends, colleagues, and guests to ITI Academy Live. My name is Will Martin, and I'm going to be speaking to you on aesthetic risk assessment, both in the partially and completely edentulous situations. But before we get started, a little bit about myself. I come to you from the University of Florida College of Dentistry, where I'm a clinical professor. In addition to that, I'm the director for the Center for Implant Dentistry. Housed within the Center for Implant Dentistry, we have a ITI Scholarship Center where we've been hosting scholars for over 20 years. In addition to this, I'm the U.S. Section Chair, and I'm just honored to be spending this time with you. So let's just really get started on aesthetic risk in general. Aesthetic risk has its history in the ITI, and I'd like to talk to you a little bit about that because the backbone behind the evolution of this is really important to understand in incorporating this into your practice. It started with trying to evaluate all the patients that you have coming to your practices that have missing teeth that are hoping to get rebuilt or put back together with ideal results. Is there a potential, or is there a way we can predict the potential for an aesthetic outcome on all these patients universally? I mean, if you think about these patients on the screen here, they're all going to have different outcomes. Some may require pink porcelain. Some are going to have long contact areas. Some are going to require major grafting. And we're not going to get consistent outcomes across the board. One of the things we've learned over time is some of these compromises in aesthetic outcomes are influenced by accumulation of factors that build up on themselves. So in order to achieve consistent outcomes, it's important to communicate these limitations with our patients prior to initiating care. I always find that if I educate the patients about the potential risk in their treatment prior to initiating care, they're usually more accepting of the outcome.